Hello. So let's continue our discussion on bleeding in late pregnancy, which is also called antepartum hemorrhage or APH. Now, today we are looking at placenta previa. Remember the discussion on the placenta locations. Yes, so when we say placenta previa, or you take a scan and then the sonographer says that, or your midwife says that the placenta is low lying. Basically, we are trying to tell you that the placenta is below your baby. So, for instance, if your baby is, in the center of your uterus, we expect that the placenta should be up, okay, be above the baby. But then in placenta previa, the placenta is low lying, and we have types. We have complete placenta previa, where it completely covers the cervix, that is the opening of the uterus. And in this type, it will be difficult for you to have a normal delivery, because once you get into labor, the way it's blocked by the placenta, and then there is partial placental previa, where it partly covers the cervix, and that one too, it will be difficult for you to have a normal delivery. Once placenta starts opening up, uterus is contracting, your cervix is opening, the placenta starts detaching, and then it comes with severe bleeding. You may end up losing your baby, and you may even have many complications. We have marginal placental previa, where just the edge of the placenta, so it's at the side of the uterus, and then the edge of it is down on the closer to the cervix. And then with the low lying placenta, your placenta is down, okay, it's down, but most of it is in the upper uterine segment, just a little of it is in the lower. So with the marginal and then the low lying, it is possible to have a normal delivery. Most of the times, if you have uterine fibroids, if you've had many pregnancies before, if you have scars in your uterus, and then your age is above 35, you are someone who smokes a lot, and other factors, these are some of the things that could predispose you to having a placenta previa or low-lying placenta. Mostly when you have placenta previa, it comes with bleeding. Sometimes when you are bleeding, you don't feel any pain. You just start having bleeding. And sometimes when your baby is not lying well, most of the time, it is just because of the placenta previa. Because the placenta is covering the down part. Mostly your baby may be transverse or oblique position. And then yes, and then you realize that instead of baby going this way, baby is like this, transverse or oblique, because the placenta is occupying the lower part of the. Report any form of bleeding to the hospital.